mp4, a consultant pediatric surgeon with FMC Medical Center Abuja. I'm the current HOD of Surgery Department. Again, we've had heads of this department. Each of them have worked so hard to get to where we are today. By the grace of God, I'm the one piloting their faith for now. This department generally is designed to give surgical services to our patients, and we do that with empathy. We care for surgical needs of both children and adults. And we have a mission, which is also the mission of the hospital. This is what guides what we do. And our mission is to give highest quality of care to these patients. Achieve clinical excellence that you can compare to anywhere globally. Of course, the ultimate goal is for a patient to be satisfied. So we work so hard to achieve patient satisfaction. This is the mission of the hospital. This is also the mission of the department. Yeah, the department is structured in such a way to give specialized services. There are a lot of specialists giving specialized services. So we are structured into 6 sub-specialty. You can call that sub-units, you can call that divisions. So we have about 6 of them. We have pediatric surgery units, which I am one of them. There we have 3 consultants, including a professor in that unit. Our work is to offer elective and emergencies to children from 0 hour of life down to 15 years. After 15 years, that's 16 and above, the general surgery will take over. So we have pediatric surgery unit offering these services. We have general surgery unit offering services to adults far from 16 onward, upward. They offer those services. And these services are routine because we have the specialists with us. We have about 5 specialists in general surgery offering all ranges of surgical care, including laparoscopic surgeries and other specialized care. We have cardiothoracic unit. I can tell you now that by the grace of God, through the inspiring leadership of our medical director, that open heart surgeries are now routine in this hospital. We have 2 cardiothoracic surgeons that does routine open heart surgeries. Again, we collaborate with international organizations. But as of today, FMC Medical Center Abuja offers routine open heart surgery. That is a cardiothoracic subunit. We have a plastic and reconstructive unit that manages burn patients, all manner of wounds, cosmetic surgeries, and so on and so forth. So all those services that we seek for abroad, if you try FMC Medical Center, you may be surprised that those services are here with us in Abuja. Of course, we have urology. Here we have 4 consultants and 1 visiting consultant, making it 5. All manners of surgical care, including laser surgeries, endoscopy, urological surgical services, they are available. Stone retrieval, removal from patients are routine. Prostate treatment are routine. All general urology, they are routine in this hospital. We have the manpower, and patients are highly patronizing us, and we are grateful for that. Of course, we have neurosurgery. In neurosurgery, we have 3 consultants. We have 3 consultants that are readily available to give services. In neurosurgery, both elective, emergency surgical conditions are attended to. They do pediatric neurology here, all those conditions in children that are related to that field is handled there. They also do neuro-oncological surgical services, brain and spine surgeries, and all manners of surgery. Currently, through the effort and support of our medical director, we just got an operating microscope for neurosurgery. I'm not sure how common is it in the country because it's a costly equipment, and that is a game changer because it offers magnification and illumination, so it becomes easier to operate on the brain, which we know is very delicate. So this hospital have an operating microscope for neurosurgeons. So across subspecialty, we move from traditional baseline equipments to other surgical equipments. So on the whole, in surgery department, we have about 21 consultants in different sub-units. And what is their mandate? The mandate is to offer services, but that is not the only thing we do. We do training and we do research. The department have accreditation from both colleges, West African College of Surgeons and National Postgraduate Medical College of Nigeria. We have accreditation to train junior doctors, junior colleagues. Now we train medical students from Beige University. They are currently being trained here. We train resident doctors, both junior and senior, what we call membership of Part 1 and fellowship training. We are currently doing that. In fact, we've been doing that for the past 6 or 7 years now. We train house officers for their house job. We train our primary staff, and we also train from other departments that send their residents to us to train. Of course, we have a lot of academic consultants, academic consultants working with Beige University and other universities. So they're doing research, and as we do our work, again, we write to let the world know what we are doing and also share knowledge. So across subspecialties that I've mentioned, about 6 of them, there are publications that when you search, you will know what the hospital is doing. So overall, I think this is overall how we are structured. But to summarize it, I would say that we don't just care, we care with empathy. We care trying to achieve clinical excellence, and they will measure our services by the feedback from the patient. And our patients are free to give feedback to anybody. They can give back to anybody, from the highest in the hospital to the lowest outside the hospital. But the feedback we get is that largely our efforts have been appreciated. No wonder one of the private study group in Abuja that designed some questionnaire went to the streets and took sample of patient preferred destination in Abuja. And by the grace of God, Federal Medical Center came out the most preferred. So that is a feedback, and the study wasn't done from within here. So I think patients appreciate what we are doing, and what it means that we should do more, double our effort, and make sure that the ultimate goal of healthcare is that patients are satisfied with what we are doing. So that is how we are structured. All the subspecialty surgeries, we have manpower, we have the equipment, we have the capacity, we have the support, and we can collaborate outside here. So the aim is to care for the citizens of this country, starting from Abuja and the environs. And of course, outside Nigeria, we receive a lot of patients outside the country coming here to seek care, and they are not disappointed. So for the future, just like we said, we want to do more. We want to give more knowledge, all for the benefit of our patients. So in the near future, we want to further expand our services. And that future is actually now. Because if you come in, you will see the efforts by our medical director. This hospital wants to start renal transplantation. The structures are put, the equipment is coming in, So the nearest future, that's why I say the future is now. Here we should be able to do renal transplantation. So that is on the pipeline. I think we are not doing badly. I can say that the basic surgical needs of Nigerians are taken care of, with hope that in future, renal transplantation, cardiothoracic surgery, we are doing open now. We can start doing minimal access. These are sub-specialization, minimal access thoracic surgeries. These are possible. Laparoscopic surgeries we are doing now. In the near future, we want to do robotic. These are possible because they are done. Further training, encouragement, push, and passion for patients. So that in the near future, all these things, by the grace of God, should be said of FMC, so that we'll keep leading the light.